Hi, I'm Anka, and this is the place to be to hear about the latest tech trends in healthcare. A couple of weeks ago, a group of researchers published a commentary in the journal Science explaining how NFTs could transform health information exchange and help patients regain control over their health data. The party is over, my friends, and things are getting serious. The time when NFTs were just overrated pieces of digital art is long gone. NFTs are entering the health space to tackle one of the burning questions of the past couple of years. Who owns health data? Could it be that these tiny pieces of code help us find an answer to such a huge question? Let's see what researchers have to say. First things first, it is undeniable that health data has become a precious asset in the medical field. Not only is it used to correctly treat patients, but it is also what fuels the development of AI and machine learning algorithms, which represent the future of the industry. But it is also undeniable that patients are often left out of the equation and rarely know what happens to their health data once they share it with a doctor in the privacy of an office. In fact, as the article highlights, the market is dominated by major players that operate in very opaque ways, and patients can't really decide which of their data is shared with whom and under which conditions. This leaves the opportunity for what researchers call a digital marketplace for patient-controlled health data using NFTs. Now, before explaining how such a marketplace would work, quick reminder of what NFTs are. If you have already watched my previous videos where I explain this, or if you are familiar with NFTs, you can skip this part. As the article explains, NFTs are pieces of code made of two components: a 40-digit long unique identifier, also called a hash, and a URL linking this piece of code to an online content. NFTs are therefore not the content itself, but rather they contain a link to the content. So, when you purchase an NFT in the form of a digital painting, let's say, what you actually purchase is a unique identifier linked to an image. Once you make this purchase, you have the access rights to this image. It belongs to you. Now, if you transpose this to health data, an NFT would designate a patient-controlled copy of digital data. To that, you can add a set of instructions, such as the conditions under which said data can be accessed and used. Researchers identified two scenarios in which NFTs can be used for personal control of health data. In the first scenario, data generators or custodians, such as healthcare facilities or labs, would have to upload the data on a public blockchain, creating NFTs. Access rights would be encoded in a smart contract to control access to the encrypted health information. Another researcher suggested in previous study that patients could prosent to sharing their health data, meaning they could specify in advance in which context and with whom their data can be shared without needing to give their consent every single time. Moreover, if their health data is sold, patients could automatically receive part of the funds and be able to track who the new owner is and how data is used. The second scenario can very well work with the first one. Here, data stays where it is, which could be a hospital's database or a patient's phone. The smart contract then sends an algorithm to wherever the data is to analyze and summarize it. This approach reminds us a little bit of federated learning, where instead of centralizing all the data in a pool, algorithms are sent to existing databases. The original data is never moved or accessed by third parties. By implementing one or both of these scenarios, we could see entire new industries and solutions emerging. For instance, some companies could create marketplaces that help patients aggregate their health data as NFTs and manage smart contracts for access rights. Data requesters, such as researchers or pharmaceutical companies, could easily verify the authenticity and the provenance of the health data they purchase and use. Now, of course, this approach still holds a lot of challenges. Among them, data security and privacy concerns, intellectual property rights, or even sustainability. But for this system to ultimately work, one of the first steps is adoption. And to create adoption, patients need to be able to use this type of services very easily. As we're filming this video, there are still a lot of improvements to be made before we all have, our wallet containing our health data as NFTs. But this is not a reason not to care about it. It is never too early to get involved and find ways to help patients have more control and visibility over the use of their health data. So thank you so much for watching today's video, and I'll see you next time.